What's up, guys? Chad Macias here, Institute for Human Kinetics. I'm here today with Dr. Gamboa. He's who we use exclusively. He's our PRP specialist. He's also a hyperbaric doctor, and he treats thousands of world-class athletes. He's treated tons of our athletes before, and a lot of athletes have questions about PRP. What is it? What can it do for the body? Is it something that's legal within their sports organization? So hopefully we can answer a couple of those questions today and give you a little bit more information about PRP before he's actually going to be performing it on Pierre-Luc Gagnon, one of the top extreme sport athletes of all time. So Dr. Gamboa, can you explain possibly to people out there that don't understand what PRP is and exactly how we get it and what it does?
Sure. PRP stands for platelet-rich plasma. Platelet-rich plasma is a form of proliferative therapy. It is a form of therapy that is from autologous blood, your blood, and what we do is we concentrate the platelets, which predominantly find and have on hold all the what we call the growth factors in the body that stimulate growth to the tissue. They're all held within the platelets, and we separate the blood, which is basically discarded when we concentrate this growth factor. The question has been brought up as to whether or not PRP is safe, is it legal, is it considered doping? And I'll answer all three. One, it's very safe because it is your blood. You can't really typically have a reaction to your own blood because it is your blood. Sometimes you'll have a reaction to the air because of the anesthetic that can happen, but for the most part, if you have no issues within your blood, there's no cancer, there's no autoimmune disorders, there's no medication that are circulating in your body at that time that may be concentrated and then re-injected to an area, they're relatively safe. Secondly, is it considered legal? Yes, it is. It's 100% legal. It's been around for, I'd say, over 40 years now. Started off in the ENT and the dental industry to stimulate tissue to grow, facial reconstructive, plastic surgery. We found that it stimulated tissue in the area. It didn't stimulate, per se, stem cells directly from the PRP, but it drew in stem cells as a chemotactic effect. It drew in all the stem cells that were circulating in your body, which we have on a regular basis. Every day, every person has that, and it draws in that tissue to the area. It stimulates collagen, stimulates growth factors in the area. So it is essentially a activation of the area to start healing again, as you would in a regular trauma or an injury. Third thing is there any issues with self-doping? There was argument with the Olympic committees and professional athletes, especially among athletic commissions, that is this considered doping, considering that the body does produce medicine-like effects. Our body does it all the time. In this particular case, there was nothing being produced that was not already there. So we were not stimulating the growth of anything that was not already in your circulation. So in that part, you can self-dope. Secondly, it's not picked up by any urine or any specific serology test. So professional athletes, football players, boxers, fighters, all can do this without having any traces of any fluctuations of any derivatives of growth factors that are unusual. They're all yours, so there's nothing illegal about it. So that's some basic information. The location where we do it is just about anywhere there is muscle tissue, especially where tissue begin and tissue end. We call that origin and insertion sites. Most athletes will get a CT scan or an MRI, and they won't find anything, but they'll simply have the symptoms, and that means that the symptoms are there during an active phase of activity. So you won't see it when you're laying on a CT scan because you're not actually firing muscles. Once you start to load those muscles with either weight bearing or an activity, they stretch and they create tension on the bony origin sites and the bony insertion sites, and that's where most people feel their pain, right where they anchor. And that's actually where PRP and all the different forms of prolotherapy, we feel, and most sports doctors are now becoming culturally aware of this as part of now future mainstream, is that it has its most benefit, those areas where they're not surgical, which most patients aren't, but they suffer and they want to be optimal in terms of their performance. So it's that 10%, that 15% more that people suffer from, and eventually causes pain or a compensation of movement because they're trying to avoid pain. So I have a website. It's called Sports Injury PRP. It can be looked up. There's information on that, and there's an ebook coming out in chapters in proliferative therapy, which I wrote. So enough information out there. I think it's important for the athlete or the avid athlete, not necessarily the professional athlete, to be aware of it, because I think this is our future. This will be mainstream, I believe, in the future. You can do so many knee replacements and so many hip replacements, and there's just not enough to go around. And I think if we catch things at an early phase, there's an enormous response from patients, athletes, so they can recover faster. The recovery time is also accelerated, and we're seeing individuals recover at a 5 times higher rate than those just by basic traditional physical therapy.
Awesome.
Yeah.
Another thing that people are kind of curious about when you're talking about different types of tear within muscle tissue, there's grade 1, grade 2, grade 3, and I know we use this a lot with our athletes to help avoid having to go under surgery, and because it provides an increased recovery time. So can you kind of maybe talk about what the difference is between a grade 1, grade 2, and grade 3 tear?
Sure. I think there's a semantics issue when it comes to sports medicine and the general population. When we describe sprains and strains are essentially forms of a micro tear. They are forms of tear, but there's the type of tears that we typically can recover from. We sprain our ankle, there is a stretching or a small tear within the fibers of the ligaments. That's what we would describe a sprain, an ankle sprain, a stretching of typically, for example, the ATF, anterofibular ligament, and that stretches and it causes tears that are functional, and still people can function on them and ambulate without difficulty, but they're torn. They become weak and they become scarred with time. And that's why you'll see people who have subsequent injuries of the same area because it was a tear, but it didn't completely heal, or it healed to the best the body could at that time. So grade 1 tear is essentially a tear that expands and disrupts the fibers within the tissue. So we call those intrasubstance tears. So imagine a rope tied up together and the fibers of the rope opening up. That, though it's not a longitudinal tear, it's a intrasubstance disruption of fibers. And if you saw that on the cable on a bridge, the bridge would collapse because the tensile strength starts to become weaker. That's how they're so strong. And we describe that, for the most part, as a class 1 or a grade 1 tear. A grade 2 will start to do the same thing, but now it's come apart. So they're still connected, but now there is the tensile strength has become weak and the fibers have actually come apart. But there's still inherently the architecture is still present. It may not be picked up on an MRI. It may be described as swelling or fluid, as an MRI does. It picks up edema, swelling, and that's interpreted as and clinically correlated to a specific signal. And most patients will describe a pain or an instability of that area. A grade 3 is a lot more commonly known. That's where we see those surgical tears, or sometimes not surgical, but they're complete disruptions of the tears. They're intrasubstance full thickness tears. We'll see that in a shoulder, an Achilles areas, or a bicep, distal bicep tears where they actually come apart. They might still be lingering on with fibers, but for the most part, the muscular unit has come apart. And that means there's no functional strength in that area anymore. And that requires typically a surgical repair if there's one available. If not, it becomes a site of potential proliferative therapy. So those are the 3 primary tears that we see. And the tears that most of us in sports medicine see will be the non-surgical ones. And that makes up about 95% of all injuries. So if you're looking to the surgeon to fix non-surgical issues, they may direct in the right field for rehabilitation and therapy. But if it persists, I would seriously consider doing PRP.
Awesome. Okay, guys, hopefully that answers any questions you could have about PRP. We'll have links to Dr. Gamboa's site on our website. We'll be putting up the video of performing the PRP on Pierre-Luc Gagnon so you can get an idea of what exactly it looks like. And thank you very much.
A little bit of those cells in the bottom. Starts to get cloudier. A little more cloudy. Not as clear anymore. Now the cells are in there. And they're more concentrated because I've taken off volume off the top, which didn't have a lot, so I'm mixing up these cells into a lower volume, hence more concentrated. So you're getting most of your concentrate in a lesser volume. I want to use it as a filter so I can keep the separator from picking up any of the resin in the bottom in So now I can separate out.
Wow, that's pretty impressive.
Doing right here.
I'm taking off the top portion of the PRP, which is the lowest amount of platelets in concentration.
And discarding them, or
I'm not going to discard them. There's still platelets in it, but there's the lowest concentration.
Look, this is a fisheye. You barely have to look.
So these are my purest forms right here.
Mm-hmm.
Okay. Now the one I discarded, I'm going to keep using that one because there's still some in there. And I'm going to use the remainder of these in here to put into the second batch. So they'll still be used and functional for you.
But they're not as good as the other ones.
They are present, but not as concentrated. These are as high as 7 times more.
Mm-hmm.
These are probably close to 3.5 times more.
Okay.
So still more than your.
Yeah.
But not as. Okay, good. Relax your neck. Yeah.
and that's all the IT band insertion.
Mm-hmm.